Hello, everyone. I'm Alejandro Rodriguez. The topic of my research asked the question of what is the relationship between LGBTQ plus individuals and healthcare. In the findings of the article, is age just a number, ageism and quality of life among Filipino LGBT older adults? The authors found that ageism is a huge predictor on the quality of life of older LGBT individuals in the Philippines. Gender and age-based discrimination are also contributing factors to their quality of life. 155 Filipinos were part of the study ranging from the ages of 45 to 74, and they self-identified as LGBT. They were recruited through in-person campaigns and social media as well. The authors conducted the study in two phases. Phase 1 is a quantitative cross-sectional design examining whether ageism predicts quality of life. Phase 2 is phenomenological, using in-person semi-structured interviews and thematic analysis. And Gendi writes, Philippines, an outright international group, surveyed 103 older LGBT Filipino adults in 2023 and found that 58% refrained from seeking medical attention due to fear of being discriminated against. The results found that studies on LGBT found that age discrimination combined with LGBT discrimination predicts depression, anxiety, and low quality of life, meaning healthcare, low income housing, social support, home assistance, legal services, and mental health. The goals of the study was to bring awareness to the older LGBT Filipino population and for policies to be drafted to enact anti-discrimination towards LGBT individuals, provide healthcare training, provide healthcare training, the implementation of cultural competence and sensitivity toward LGBT elders and healthcare providers, and for the creation of inclusive community programs that help elders, awareness campaigns, support networks, and for more research on LGBT Filipinos to be continued as there is little currently existing. The sexual orientation of LGBT people makes them targets of discrimination that, coupled with experiencing discrimination through ageism, becomes a precursor to causing poor health conditions in these older individuals. Not to mention, studies show that 2 out of 5 LGBT individuals on Medicaid have reported being in fair or poor health, and about 50% of LGBT people reported having ongoing health conditions that required continuous monitoring, as opposed to only 45% of non LGBT individuals. LGBT people are more likely to have a telehealth visit within the last 2 years as opposed to non-LGBT individuals, 63% as opposed to 53%. LGBT people are more likely than heterosexual individuals to have a sexually transmitted infection other than AIDS of 37% to 19%. 35% are more likely to have HIV as opposed to 19% of heterosexual individuals. More LGBT people reported needing mental health services than heterosexual people, 67% to 39%. This information is from the Kaiser Family Foundation website. Now, the authors of LGBTQIA plus inclusion in the Global Health Policy Agenda, a critical discourse analysis of the Lancet Commission report archive. They conducted a study on the influence that the Lancet Commission's report has on LGBTQIA plus health concerns and policy. The authors recognized that the LGBTQIA plus communities face marginalization and wanted to see if the Lancet report reflects that and offers a solution for overall inclusion of LGBTQIA plus health outcomes, since they have a significant impact on healthcare policy. Their study uses critical discourse analysis of 102 reports. They used a framework that searched for 36 key terms in regards to the LGBTQIA plus community. They found that only 36 of 102 reports mentioned the LGBTQIA plus communities, and there were 801 total mentions with all the reports combined. They also found that LGBTQIA plus had a greater mention when discussing HIV and AIDS. Reports that discussed public health and chronic conditions didn't mention them at all. The authors found it troubling how the LGBTQIA plus communities were discussed. They were discussed in reports that labeled them as victims, but it was troubling since they didn't mention the root cause of the problems, like homophobia. Authors found the reports portrayed the community as attracting violence without actually explaining why that is. This is significant because we have proof that LGBTQIA plus communities don't really seem to be a big topic on the healthcare discussion. Sure, they were discussed, but not thoroughly and properly, further perpetuating the conditions for poor health outcomes. How are they to have a good relationship with their health and health?